ain't here to negotiate. Unity is all we need. Future's ours at God's speed. Can't fall for no division. Divide and conquer is their mission. So they hid our history, but now we know our legacy. Yeah. Africa, the foundation. Black wealth for generations. Home is where the heart is. They can't do nothing about this. It's the awakening. They ain't ready for the reckoning. No Wakanda, this is Africa. Black wealth, this the black Mecca. Elders kept the dream alive. Gave us vision, so we gon' thrive. Free your mind, don't fall behind. The real truth ain't hard to find. Corporations in cooperation. The new Africa in operation. Building the homeland, calling our people to the motherland. Allow it, this is destiny. We here now, it's reality, yeah. It's the African dream. Melanin is the light.
Welcome to the Africa Must Unite podcast. A podcast dedicated to inspiring African people worldwide to rise up, organize, and struggle for Pan-Africanism, a unified, liberated socialist Africa, the only permanent solution to the exploitation and oppression of African people, no matter where they happen to be born or to live in the world. Now please, welcome the hosts of Africa Must Unite.
Building the black Mecca, calculated like algebra. 2050 is the future, bro. What? Yeah, eyes open, we see the vision. Building Africa, the only mission. Like Omar, if I thunder, we be Pan-African all day. The time is now, this is a moment. We ain't asleep, we ain't dumb. All day, every day, we building our shit.
Pan-African greetings out there. I am Brother Terrence.
And this is Brother Melvin.
And this is the Africa Must Unite podcast. And we are the Pan-African Revolutionary Socialist Party. Podcast number 101 here. 101.
Yeah, we've been around for a minute now. So 101. It's a milestone for us. But as we do every podcast, we want to just start out by mentioning some dates, some important dates for the month of May that we can recognize. Starting out with May 2nd, we acknowledge the Sada Shakur attack by state troopers on the New Jersey Turnpike in 1973. Going on all the way to May 13th, where Philadelphia police bombed the MOVE headquarters, killing 11, including 5 children, and destroying 65 homes in 1985. One of the few events where the actual U.S. government dropped bombs on its own citizens. How about yesterday, May 15th, we acknowledge and recognize International Solidarity Day for our Palestinian brothers and sisters, and Free Palestine. On May 19th, we look at Ho Chi Minh, who was born in 1890, as well as the Pan-African great Malcolm X, El Hajj Malik Shabazz, was born in 1925. On May 25th, we do recognize the formation of the Organization of African Unity, African Liberation Day in 1963. Moving on to May 28th, we acknowledge Sojourner Truth, African freedom fighter, who attended the Women's Rights Convention in 1851. And also on May 28th, Maya Angelou, distinguished author, transitioned in 2014. And rounding off the month of May, we look at the final day, May 31st, in Greenwood and Tulsa, Oklahoma, also known as the Little Africa. White supremacists murdered more than 300 Africans in 1921, which also the second time the U.S. government bombed its own citizens. So you see that happening with the Operation Move and on May 13th, and then on May 31st, where Africans are tortured, tormented, and massacred by its own government. So that's the month of May. There are a ton of days that we also acknowledge, but hopefully you'll pick up one of these calendars and see those days as well.
Yeah, that was interesting. The 2 times the bombs have been dropped are on African people.
That's right.
Tulsa, and then in Philly.
Yeah.
Yes, indeed. All right, so Africa Must Unite podcast here, number 101. Continuing with our theme for the year, socialism, an imperative for a liberated, unified Africa and for the liberation of all global Africans. We want to focus on healthcare this month. And like we typically do, we read our calendar piece on healthcare to lead into our discussion. So what we said about healthcare was, across the world, Africans are those who are in the poorest of health. Worldwide capitalism in all of its manifestations, that's neocolonialism, settler-colonialism, domestic colonialism, has denied them their basic needs to sustain healthy and productive lives. It is only through a unified socialist Africa that global Africans can be assured of addressing their healthcare needs. Whether we are residing in developed nations like the global North or developing nations like the global South. As Africans, our concrete health concerns can only be met when Africa is united and unified in socialism. Just looking at capitalism here, under the yoke of capitalism, healthcare for all Africans is marred by no or limited lack of clean water and sanitation. Diseases for which these are cures. Healthcare inequalities for our people are abound. Sub-Saharan Africa accounts for the highest number of deaths and disabilities due to infectious disease in the world. I just saw a report yesterday where 65 people in Democratic Republic of Congo died of Ebola. That was just reported. Women and children are particularly vulnerable, having the world's highest maternal and under 5 mortality rates. Global Africans, no matter where they're born, have higher rates of chronic diseases, the worst healthcare outcomes, and shorter life expectancies. Under a unified socialist Africa, these healthcare concerns will be met through scientific planning by a centralized socialist government. Africans throughout the world will be guaranteed free healthcare. The alliance of the Sahel states, Burkina Faso, Mali, and Nigeria shines the light forward in what collectively could be done for our people. But while regional unification is a step forward in our struggle for liberation, it is insufficient. Only a unified socialist Africa will guarantee the health of global Africans.
Absolutely. So we take that point, just highlighting the impact of capitalism on our healthcare system. Obviously, under capitalism, the primary objective is to increase profit for the capitalist class, increase money. So when you take out the profit motive in capitalism, then and you move into a socialist reality, you see there is no interest in just making money. And the truth of the matter is, healthcare is a multi-billion-dollar industry, right? And making its money not off of healing people, but actually treating them. So, it serves their interest to make sure that you have sick people in the world. Look at the food that we're eating, the water, our water systems and all of that thing. And then the areas that they tend to impact, the communities that are impacted mostly tend to be Black and brown people, African people mostly. So that is just one of the byproducts of capitalism. But to your point, yeah, you was making a point, T?
No, I'm just saying right.
No, so, we wanted to look at, how, capitalism is impacting, Africans around the globe, actually, and kind of talk about how what we're seeing, for instance, in the Sudan. The current war in the Sudan has been going on since April of 2023, and in that time, the country has been plunged into a rapidly deteriorating humanitarian situation, creating famine, food insecurity, and displacement crisis, health conditions which are exacerbated by the imperialist-inspired war causing the spread of malaria and dengue fever, both caused by mosquitoes. In fact, due to the imperialist rape of Africa, outbreaks of vaccine-preventable diseases such as measles and polio are being reported throughout the entire continent. To make matters even worse, healthcare facilities are being attacked. There's a shortage of medicines and supplies and a lack of financial and human resources to operate health services. This means that the healthcare systems throughout Africa is on the verge of collapse. And I think that was the point that you were making earlier around the Sahel states, kind of shining the light forward and what it might look like or what it will eventually look like once we adopt that more. And we have to fight for it, that socialist Pan-African reality. And we'll see drastic changes in our healthcare systems. But that's just what's happening on the continent. When we look at Latin America and the Caribbean, and because many countries at home are forced to agree to U.S. pressures, they are now feeling the effect of not having Cuba doctors to assist in their healthcare. In recent months, many people across Latin America and the Caribbean have suddenly found themselves without health care, as nearly a dozen countries acquiesced to pressures from the U.S. to end medical agreements with the Cuban government. Since Donald Trump began his second term, the governments of Jamaica, Guatemala, Guyana, Honduras, St. Vincent, and the Grenadines, and the Bahamas, Antigua, Paraguay, have ended the medical agreements either immediately or gradually. Doctors, NGOs, and researchers agree that the people who will be most affected by the sudden withdrawal of doctors typically deployed to remote and historically undeserved healthcare areas will be the region's poorest communities. Black, brown people, obviously.
Crazy. Look at all them countries, boy, full of Africans.
Yeah, full of Africans. And then we go all over here in the United States. We see African people in the U.S. face major racial health disparities like high blood pressure, sickle cell anemia, asthma, obesity, and diabetes, to name a few. This results in certain chronic conditions being more common and worse health outcomes for the African community. Lack of access to healthcare and social and economic resources and discrimination under capitalism are often at the root of these issues. Improving access to care, health education, and supportive resources can help to decrease the health gap and improve the health of Black community or the African community overall. And this much improved access will only occur under socialism. Brother Terrence, can you speak on the impact socialism will have on Africa and all global Africans when it is the economic system that exists in unified Africa?
Yes, indeed. So when we think of socialism and we think of healthcare, that one shining bright example is going to always lead us to Cuba. And in Cuba today, despite enduring over 6 decades of an economic embargo, Cuba has achieved remarkable public health milestones. The following list is key accomplishments of both the Ordóñez Carceller Polyclinic and the Cuban healthcare system as a whole. In the area of AIDS, Cuba identified HIV in 1983 and quickly set up a system to track and treat it. By 2014, it eliminated the mother-to-child transmission of HIV and syphilis, a milestone the U.S. has yet to reach. In COVID, Cuba developed 2 COVID vaccines and kept infections low and even sent vaccines abroad. Diabetes, the nation developed effective medication that treats diabetic ulcers. In Alzheimer's research, Cuba has developed a drug that may help reverse Alzheimer's effect. The maternal fetal medicine, 99% of Cuban children are vaccinated, and the country has a lower infant mortality rate than the U.S. In nutrition, while obesity is not an issue in Cuba, malnutrition is increasing concern due to the shortages caused by the U.S. embargo. Home health doctors make house calls to care for the elderly and new mothers. And Cuba has a program that is bringing in young Africans from the U.S. to Cuba in order to train them as doctors. And obviously they take that experience and go back and work in their African communities and poor communities and help out there. Another thing about Cuba, they have this program that they worked with in conjunction with Venezuela called the Barrio Indigno, which meant inside the neighborhood. And in exchange for supplying Venezuelan oil to Cuba, arrangements were made to bring Cuban doctors and healthcare expertise to Venezuela. At the same time, initiatives were taken to send Venezuelan students to Cuba to study medicine and healthcare. Influenced by Cuba's example, an alternative medical education structure was created outside Venezuela's conventional medical educational system, called the University Without Walls. Its main objective was to ensure that new medical students could receive their education without becoming detached from their own communities and social environments, like what they wanted to do with Africans here in the U.S. This comprehensive program is designed to create a new kind of doctor who is part of the community healthcare system. The experience of this healthcare system has had a significant impact on the development of public health in Venezuela. As opposed to the capitalist economic systems, Venezuela and Cuba serve as concrete examples of what socialism can do for its people. And we just want to say it's a simple conclusion. You know, in order for global African people to survive and live healthier lifestyles, socialism has to be imperative.
Yeah, that's just a fact. I was just thinking as we was talking about, you know, healthcare and how it impacts, you know, even the people that we are around, right? Like, for instance, your moms and your pops, they deal with specific healthcare issues. My mother is dealing with specific healthcare issues. We have friends who are dealing with specific healthcare issues, and we have people with insurance and how costly it is at this point, where people are actually at a point where they have to make a decision. You know, and this is another offshoot of capitalism, right? When our family members, our people that our loved ones are forced to make a decision as to whether or not they're gonna put food on the table or buy the insulin that they need or buy the medication that they need, is a terrible situation to be placed in, and it's again, an offshoot of capitalism. You look at socialism where, you know, you remove the profit motive. And so the big pharmaceutical companies aren't making money off of the medicine because it's provided for all people. That's the idea that we need to be working for. And that, you know, that can only happen outside of capitalism. We have to continue to work towards Pan-African, a reality where we unify home first, under a socialist government, socialist reality. So then we could see the spread of that worldwide. It just brought home to me like this reality that so many people that we know personally who are struggling through making those everyday decisions around healthcare.
Yeah, absolutely. Throughout 2026, at times, with help of invited guests, our focus will be on the theme of our calendar: socialism, an imperative for a liberated, unified Africa, and for the liberation of all global Africans.
So join us next month, June of 2026, and we'll be focusing on education and have a discussion around education. Meanwhile, visit our website, PanAfricanRevolutionarySocialistParty.org. Email us at PanAfricanRSP@gmail.com and like us on SoundCloud.com. Visit us and leave comments on YouTube.
Remember, organization is the key. Join us, the Pan-African Revolutionary Socialist Party, or some other revolutionary Pan-African socialist organization. A union of African socialist states is on the horizon.
Kill those that are killing themselves. Don't make it an easy job for them. The killing of kids with £2 chicken and chips is a tactic of war waged on the poor. Can't save wages on slave wages, and you don't think fresh fruit with your face on the floor. Nah, you need money for the kids, rent and light plus food in the fridge. But that last box can be the hardest tick, cause scraps will suffice, but they might make you sick. As a child I used to chow takeout, 24 hours later skin breakout. Felt so heavy with it sitting in my belly. Dessert was a sugar coated candy jelly. Fam, that's pig meat, mashing up the kidney. Make sure no government has to kill me. I was killing myself till I realised danger. Brain, heart, liver and lungs can get failing. Now seasoned dal and veg and fresh herbs. Cut caffeine because it messed with nerves. Plenty lentils and chickpea curry. 20-minute meal for a man in a hurry. That's real fast food that won't break the bank. With enough nutrients to fill the tank. Drink water for the body's natural power, but water from taps can taste sour. Food deserts are designed to starve us. No fresh produce, but we got Starbucks calories packed in treats to enlarge us. May not see the effects, but the heart does. Can't breathe, can't sleep, can't run. Casamorphin wreaks havoc on the lungs, just like fizzy wreaks havoc on the gums. And my old man said diabetes ain't fun. Ginger root is good for the youths. Blend it up and share a fresh juice. Burn sage, cleanse the room. Body is a temple, don't let it be a tomb. The food you choose to consume can damage. Processed meats intestines can't manage. Cattle farming still killing off the planet, and it tells us every day that it can't stand it. Earth getting hotter while the sea levels rise. All because you want burger with those fries. All because you want milkshake with the milk. And to combat diarrhea you take pills, what's the deal? Eat right, stay active, stay strong, cause the revolution is real. Never know when a man might have to dash, and a pig can't kill what a pig can't catch. It's more than just eating right, it's survival. Rasta man tell the youth eat idle. Daily exercise for share is vital. Whether you short walk, run or take cycle. Meditate to live life and love it. Plus stress increases acid in stomachs. Read and chill to keep the mental covered. And when you find struggle, try rise above it. I find peace in the books on the shelf. Food on the stove while it cooks. I can smell it's gonna be good by the looks. I can tell when it won't put my body through hell. Well, I want strength like Phelps. Good practices and discipline helps. Not for the six pack, I do it for myself. Cause it's true what they say, your health is wealth.
Be healthy, be strong, right? By the way, remember you're a gift to yourself and a gift to your environment. Continue to be that beautiful gift. Share that gift in your food and all your gastronomic mastery.